The practices US are totally different from what we do here in Uruguay. Latin America, maybe I wouldn't dare to say the whole Latin America, but in Uruguay, it's totally different. The way we work here, all dentists are actually really alone. Dental insurance does not work. That's something really different from US, I know that. And Brazil also works a lot with dental insurance, but here we do not do it yet.
There's no dental insurance down there?
No dental insurance.
So everything's cash.
Exactly. We are all looking at making money. And what happened was, there was actually a clinic here that was a huge clinic, only orthodontics, that had this $100 orthodontic for everyone. And they took all the money and left the patients with the orthodontics and no treatment.
Welcome back to another episode of Dental Marketing Go. I'm your host, Gary Bird. I'm the founder of SMC National, where we help offices just like yours level the playing field against the big guys out there so you can grow the way that you want. But you can't grow the way that you want if you're in a country where people don't understand how important dentistry is. And today is a very, very special episode. We're going to talk to Marcel, who's a partner and general manager of a practice in Uruguay. That's in South America for you guys out there that don't know where that's at. And he's going to break down what it's like being or owning a dental practice down there and being a dentist down in that area. And you're going to love it. Trust me, there's so many gold nuggets in here to learn from and to see what other people are doing. And I'm always learning. So this is one episode for me where I got to learn a lot. So this is one of my favorites. So stay tuned for this one. All right, we are live and I have Marcel here. This is going to be a really cool episode. This is going to be a first. Never done something like this before. And Marcel, we met online. I think we were DMing somewhere. We were chatting on Facebook or Instagram. And he told me, I said, well, how many practices do you have? And he said, yeah, I have this many practices. You had several practices and you're in Uruguay. And then I had to look up where Uruguay is, right? And so Uruguay is right below Brazil, right above Argentina on the east coast of South America. So you're on the New York side of South America. And you run multiple practices down there. You're actually the partner and general manager of your practices down there. And I was like, man, would you be willing to come on a podcast and talk about what dental is like in South America? And you said, absolutely. So why don't we just start with this? Why don't you tell us how first of all, I was going to ask you about new patients, but first I want to ask you this. How are the groups set up down there? So you're a partner and general manager. Is it similar to DSOs in America, or do you guys do it differently? How does that work down there?
Okay, that's perfect, Gary. First of all, thank you for inviting me. I've been a follower of you for such a long time, so part of a dream coming true. So thank you very much. At first, I have to say, the reason why I hear so much these podcasts on US is because the practices US are totally different from what we do here in Uruguay. Latin America, maybe I wouldn't dare to say the whole Latin America, but in Uruguay, it's totally different. The way we work here, all dentists are actually really alone. During the whole career, while they study, they are trained just to be dentists and have their own private practice. Maybe if you are really successful, you get a receptionist. Even if you are just a general dentist, you send your patients to the orthodontist or to the one that makes the implant. Yeah, you don't treat everyone yourself, because you don't have the whole specializations. Sorry if my English is a little bit rusty, but...
No. This is good. So actually, you know what? I traveled. So anytime I travel around the world, the first thing I always want to look at is I want to look at everybody's dental offices, right? I'm a weirdo. And so I was in Greece and I was looking at we're in these little towns, little islands in Greece. And I noticed that they all have little offices, like the size of my office that I'm sitting in right now, with one chair and one doctor in it. And I'm like, how are they doing it? So it must be a similar model where it's just one doctor and then the whole business revolves around that one doctor and they're the only employee at the practice. Is that how it is?
That's exactly how it is. Actually, you got the doctor, that is the receptionist, that is the one that bills, that charges the patients. You are in a one-man show. Well, actually, I'm not a dentist. I got a lot of my expertise is in running companies. I actually run a marketing company for the past 8 years, and I joined this practice 3 years ago. At first, there was one dentist that hired me to make the marketing, okay? And that's where I started my relationship. Turns out that this dentist was my mother, okay? So I know that you always ask how you how you end up in dentistry. And that's how. My mother was my first client when I set up my marketing agency. And she told me, okay, now I'm going to focus on being, the best dentist that I can. So you get my marketing. And I started there. That was 80 years ago. 3 years ago, she said, okay, I actually saw her. She was working from 8 in the morning till 10 at night. And even on weekends, she was the one that was scheduling all the patients. So I said, okay, that's got to be enough because, okay, you're making money, but you're not enjoying your practice. You're not enjoying life. So at that time, I told her with my enterprise mindset, I told her, okay, how can we make this work for you, make you same money or maybe a little bit less? And then I told her that I joined forces if we had a plan, like a 5-year plan. And she told me, no, 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 there's no chance. 6 months later, she told me, okay, let's do it because I cannot take this any longer. And that's when it all started. And now I became the general manager. We got a company set up and we got 2 offices, okay, with in different parts of Montevideo. I'm in Uruguay in the capital city, that's Montevideo. And we have 2 offices, one that we opened last month actually. And we have 3 chairs there in this new one. And we got 2 chairs in the previous one. Multiple doctors, all under the same brand. We are really working our brand. We got all the specialties. Okay, we got the orthodontist, the implant. Yeah, we don't refer. We keep it all inside. It's all in our house. Yeah, because that's something. As I kept on learning about the patient, they told me what they value most is that they get stuff done quickly because if not, you get to the first diagnosis consultation, then you get to the second one, to the third, and by that time you get something that no, you for the first time you got here, you get something that at least actually, whatever the client is happy because we are fast, and then we get everything inside our house, all specialties, so you don't have to go to someone new that you don't know, and go bouncing from side to side. It's all within our house. That's the main difference. You don't got this here year one.
Voting is open for Dental Woo's top dental podcast. It starts on November 1st and ends on December 31st. Each vote supports the podcast. Last year, we won multiple top spots, and this year, we're hoping to do even better. This year, our goal is to get 1,000 unique voters on this podcast. Help us reach our goal, and your vote will count. Voting is easy. Just click the link below and find Dental Marketing Go, and then submit it. It's super fast. Yeah. Okay. That's really cool. So now how do you guys get new patients down there? Is do you guys, and specifically, especially what we're like around insurance, is everybody cash pay? How does that work?
Okay. So insurance here, dental insurance does not work. That's something really different from US. I know that. And Brazil also works a lot with dental insurance. But here, we do not do it yet. We are starting to make our own plans. We launched them last week. And now we got a big client that it's
So there's no dental insurance down there?
no dental insurance.
So everything's cash.
Yeah, exactly. It's all cash.
So that makes sense why you have a lot of single location dentist is because you're just paying like, hey, pull my tooth, here's $100. You know what I mean? And it's like, oh, here, you need a crown. I'm just going to do that really quick. And that's it. Like, so it's just, everybody's just doing the bare minimum amount of dentistry probably that they need to do to be out of pain or to fix the tooth that fell out or whatever.
Exactly. And what happens with that, Gary, is that we are not, and I include ourselves, we are not, but the dentists here are not looking at the well-being of the human itself, of the person. They're looking at the crown. They're looking at the implant. We are not looking at the whole person because you just, work for the money. That's not the way we roll here.
So what about hygiene? Who cleans the teeth? Do the dentists clean the teeth as well?
No, we do. Yeah, we do it. We have every type of dentists that say we have it here. We have several categories and everyone with their own specialization. So if you come for a cleanse, we do the cleanse. If you come for orthodontics, we do that. And now we have incorporated Asia technology to dentistry. Maybe that's something that's all for you guys. With all the technology that comes apart, for instance, we've done a $200,000 investment in technology for, I don't know if that's a lot or not there, but here's quite a lot. Uh, you're talking that if you want to put your own dental practice, like these doctors that just graduate, we're talking about maybe a $10,000 investment. We are talking 200,000 only in technology without the basic. I'm trying to look at you guys because that's why I hear all the podcasts and I try to research outside.
So you're going to launch your own membership plan then. You're going to try to get your own membership plan off the ground because there is no insurance, which is really smart.
Yeah, actually, what we're gonna do, because I've been working in insurance for a long time, so I know how it works, and we cannot have it's like a little tricky part. We cannot sell insurance unless we are approved by the central bank, Uruguay central bank. So we are not gonna call them insurance; we're gonna call them membership.
It's the same. It's the same thing in the States. Yeah, same exact thing. We're not allowed to have an in-house insurance plans. That's a big no-no. But you can't have a membership plan, and that's the workaround. And then you just have to make sure that you call it that. And yeah, I think that's huge. That's really, really smart. Probably way ahead of time of your time down there, and will go amazingly. Now, what kind of demographic do you guys serve down there for your offices specifically? Are you serving only, like, I know, like, I've heard a lot in like a lot of the Arab countries in India, they do there's a lot of people with money and everything's cash pay, and so you kind of just serve that market, right? And so is that kind of how it works down there? Are you serving more of the middle class? How does it work in Uruguay?
Well, it's funny that you say that because with the first dental office we had, it was a very specific type of market, and it was a middle class, let's say lower middle class. But what happened is we are not cheap. Actually, we are a little above our prices, a little bit above of the competition here in Montevideo. We still had a lot of patients that are lower middle class that make an effort and pay. So that's something that we were used to. But now that we open our second branch, the clients changed drastically. Really high profile client. Actually, we presented budgets, like supuestos individual over 1 million Uruguayan pesos. That's something that's out of anyone's mind. And what we did there, we made a partnership with one of our banks here, UBA, I don't know, it's the call, and it's really important. And what we made there a partnership in which they get a 6% interest, and you can loan just with your signature $25,000 for our treatments with just one sign and in the same day.
Okay, so now then my next question is going to be: do the patients, where are the patients at on the educational scale, right? So like you look at America at one point, barbers used to do the teeth pulling. You know what I mean? So you'd go to the barber and they would pull your teeth, right? And people didn't really know about oral health and those kind of things. Over time, people became educated. So people started being educated. You need to get your teeth cleaned every 6 months. And that's pretty much everybody knows that in the United States. Like everybody knows you're supposed to get your teeth cleaned every 6 months. Not everybody does it, but everybody knows they're supposed to do it. Now, like even 10 years ago, patients didn't really know what a dental implant was, and they didn't really understand why it was important to have straight teeth. They didn't really, 10 years ago, 15 years ago, people thought having straight teeth was like almost like cosmetic surgery. Like it was like, you don't really need that. You know what I mean? But now people understand in the United States, like, no, straight teeth not only look better, you're going to be healthier. You're not going to have as much bacteria in your mouth. You're going to be able to clean your teeth easier, all those kind of things, right? So everybody knows what a dental implant now is in the United States. Like you don't have to educate the patient on that. Like most people know that you have that as an option. Where are you at as a country on this patient educational scale? Where are you guys at?
Wow, that's kind of a hard question because I think no, you know what's the problem here? There's a cultural problem, and there's a moral or ethical responsibility on dentists. Because right now, what's happening that a lot of dentists, and I mean a lot, if you go on social media, you're going to see that you can get your orthodontics, for 5,000 pesos. It would be $125 to get the whole orthodontics. That's like a promotion. And what happens is it happens with all of dental treatments, meaning that we are focusing on aesthetics, not on well-being, not on the future of the patient of having a healthy teeth, healthy mouth, healthy hygiene. We are we are all looking at making money. And what happened was there was actually a clinic here that was a huge clinic, only orthodontics, that had this $100 orthodontic for everyone. And they took all the money and left the patients with the orthodontics and no treatment. They paid $100, it got a lot of patients, and they left. What happened? People think that having the orthodontics is just putting, pasting the bracket, pasting the bracket one by one in the middle and having like the teeth horizontally aligned. And that's not what we do. We're working on the whole alignment on the middle ear. And what I try to say, culture, you're having a cultural difficulty that we're focusing on aesthetics, not on well-being, not on health. And that's something that when you go and you get to social media, you see $100, $50, the whitening $20 because you're on promotion for I don't know whatever. It makes no sense. But how can you explain to someone to be healthy, right, and go to the checkups if they're looking at $20, I got the whitening? It makes no sense. So I think that in a cultural level, we're pretty low, and it's our duty, a dentist's duty, to try to make things better because people are losing their teeth, and they're having really you cannot imagine the amount of patient, or maybe you can because it's you, but most people cannot imagine the amount of people that come here, patients with a lot of troubles, and they've been having trouble for 10 years, 15 years, and no solution. And they're really happy to get here because they got what they needed, and there's a lot of well-being with yourself, autoestima. I don't know if you get my point. The thing is, we're pretty low. And that's a hard question because we are the ones that have to give the patients a solution with culture, with education. We actually work right now. We get a chief of press. Press. We're making going out of papers on television, talking about health and the importance of it.
So what's another thing that we would be shocked about the dentistry down in Uruguay?
What I'm really shocked is about you guys, these having clinics, the dental offices with several hygienists, with specialists. That's I think is the most shocking. The insurance part really shocking because there's no care for it here, and but there's also something that is related to aesthetics. That it's this. A lot of people are asking for this. I think in veneers. It's in English, veneers. Okay. There are a lot of people asking for veneers because they don't want to fix the real issue.
Marcel, have you heard of veneer techs? It's a new thing in the U.S. Veneer techs. So it's a new thing in the U.S. It's very bad. It's causing a lot of problems. And I think there's going to be laws around this soon and it'll change. But right now, there's these people who are called veneer techs. And I don't know how it works. It only works in certain states. But basically, they can place veneers onto your teeth and they're not a dentist. And they're popping up all over the place. They're really big on like TikTok. So kids get them. So kids will have messed up teeth and they'll just slap on veneers over the top of them. And then there's all these dentists commenting on like, this is the worst thing ever. You shouldn't put veneers on that. You had all these underlining issues. Like you're just painting your house is falling down, but you painted it. You know what I mean? Or your car doesn't run, but you put new rims on it. It doesn't make sense, right? And so that's a bit.
It's worse because you're putting the veneers right over something. So you're worst cleaner, worst, that's going.
Yeah, you can't fix it. It's very bad. So Yeah, that are you guys dealing with some of that where dentists are just slapping veneers over the top of bad situations?
It's not happening right now, but we see it as a trend that is popping up, little by little. And what we see with the new branch that we opened, that is really in a central part of the city, we are getting a lot of foreigners that come on cruises or that are living here in Uruguay. It's really a peaceful place to live, really nice place to live. And they come here with the veneers and they're starting to fall. But they're falling, they are causing terrible damage. And that's something that we didn't see on the other branch. That's part of the clients of the patient change that I was talking about before. And we are a little bit, concerned about this. And now that you said, I've seen it on TikTok because I'm
So I just looked it up. Veneer techs are actually illegal, but they do it anyways. They market it. They're illegal in the United States, but tons of people do it. And so yeah, you'll see it on TikTok. That's probably why people are asking for it down there. Is they're probably seeing veneer videos up here in the United States on TikTok and Instagram, wherever. So yeah, no, that's really really interesting. That's going to be a problem for sure. I'm assuming down there, especially being that if people want white teeth and straight teeth, like veneers is an easy way to fix that, but it's a very temporary fix. It doesn't actually fix the root cause. So that's going to be really dangerous. How can if someone wants to connect with you on Instagram, what's your Instagram, Marcel?
Our Instagram is Clínica Cavalieri. It's maybe a little bit hard to write. It's CLINICA, Clinica like that, like clinic with an A. Cavalieri is Italian actually. It's the last name of my mother. That's and Cavalieri. It's CAVALLERI. Cavalieri. Clínica Cavalieri.
Okay, I'm gonna spell for the audience here just again. So it's CLINICACAVELLERI. So go check him out on Instagram. If you wanted an easy way to go connect with him, I follow him on Instagram, so you can go check out my page, find him under my followers, the Gary Bird. It's a little easier, and they'll be able to find you there. But make sure you connect with them. They're doing a lot of cool stuff down there. They're ahead of pretty much everybody else down there. He's watching the U.S. and making decisions and learning things. So it's really really cool to see what you're doing, and I really appreciate you just coming on and sharing with the audience. I wish I could get these conversations with other people around the world because I love hearing about where people are at and what they're doing around the world when it comes to dentistry. So thank you so much for coming on.
No, thank you, Gary, for the time for the basic with my English. One more thing before we go. Have you heard about this laser technology, but just dedicated that, of course, dental, but dedicated to oncology patients with cancer? Have you heard about it? No, because that's something we are developing right now, and that's something that got the media really focused on us. And we are having a big project. Just maybe I can send you the information later because it's something really interesting. It's going directly to the well-being of patients that are having this chemotherapy or radiotherapy.
Oh wow, yeah, I would love to see that. Shoot that my way. Thanks so much for coming on.
Okay, perfect. Thank you, Gary. Bye bye.